Hello, my name is Mahek Shergill, and I'm so grateful to be one of the recipients of a Psoriasis Canada studentship this year. To tell you a little bit more about our project, we are essentially investigating biologic failure in patients with moderate to severe plaque psoriasis, and we conducted a retrospective review of a center based in Hamilton. Essentially, we reviewed comprehensive lists of all patients as a part of this practice who are receiving biologic therapy and therapy that was either discontinued or switched to an alternative agent. And we did find that so far a few key themes have emerged. Although the final data analysis is still underway, so far we found that suboptimal control of the plaque psoriasis was the most common reason that a biologic agent was stopped and or eventually switched to a different agent. But we also found that there were other reasons that necessitated stopping a biologic, including hospitalization, infections such as cellulitis, or changes in a patient's health status. Particularly, a theme that came up was pregnancy or malignancy. The most commonly discontinued biologic amongst this practice cohort was ustekinumab, which was commonly switched to agents such as sesukinumab or guselkumab, depending on the presence of other comorbidities such as psoriatic arthritis or inflammatory bowel disease. So, as we continue to work towards synthesizing the data, we find that there are gaps in the research which could explain why agents are discontinued. For example, there's little research surrounding the safety of continuing biologic therapy in pregnancy at this point, especially with some of the newer agents that have come out. And we're hoping that as we get this comprehensive list released of the most common reasons for discontinuation in clinical practice, that we're able to, elucidate more research that tells us, what guidelines are available to guide clinical management when discontinuation of an agent is necessary or when someone needs to be switched to an alternative agent. So that's where our project is at currently, and we are so grateful for your support, and thank you so much for listening to a little bit more about this project.